Hi everyone, this is Dr. Stefan. Welcome to another video. In this one, I'd like to answer a comment about taking less than the prescribed dose of an inhaler because you're trying to avoid side effects. So hopefully this is helpful to some of you who are struggling maybe with asthma, because the question is about asthma. So Symbicort, which is one type of an inhaler, was prescribed to me today, but I don't want much dependency on the medicine. Instead of 2 morning and 2 evening puffs, I'm willing to try 1 puff a day. Logically speaking, this shouldn't harm, but would make the healing process slower. Am I thinking right? So this is a very common issue, actually. It's not something that I would take lightly. It's something that I would discuss with my patient if you were my patient. Now, obviously, I'm not your doctor, so this is a video on YouTube. I don't know your individual case. I cannot give you medical advice in your situation, but I can give you an opinion about these sort of situations that happen quite often. So, many patients do worry about side effects. Sometimes they worry about side effects of medication more than they worry about their condition getting out of control. And I think this is what I would say is the key problem that we need to address. So, if you have a condition such as asthma that is associated with active inflammation in the airways that leads to the symptoms, leads to the asthma attacks, uncontrolled asthma, feeling poorly, having a bad quality of life, logically, you would want to get rid of those problems. Now, it depends. Asthma can be mild or it can be severe. You have different people. That's why one answer doesn't satisfy all situations. But in most cases, people who go to the doctor because they suffer with asthma, they have problems with their asthma. They have to treat the asthma somehow. So we try to give you some treatment. Now, we can give inhalers in most cases, or we can go down the tablet route. Now, if you think about it from a very pharmacological perspective, the dose of medication that you require in an inhaler is going to always be much lower than what you would require in a tablet, because you're trying to treat inflammation in the airways to treat the asthma. So you're inhaling the medication in the airways where the asthma is. It acts locally. It's as if you're putting ointment on a wound. So it's a topical treatment, a local treatment. On the other hand, if you're taking a tablet that you swallow, it dissolves in your stomach, gets absorbed from the gut, passes through the liver, goes throughout the bloodstream, eventually reaches the airway, you can imagine you would need a higher dose of drug to achieve an effective concentration where it's needed. So in that sense, inhalers are always much safer than tablets in a general sense. Obviously, you can overdo inhalers. You can take a lot of doses, and that can maybe make you feel a little bit strange. Your heart may race a little bit if you abuse the inhalers. But in most situations, inhalers are much safer medications than tablets. And if you take the medication well, it controls the inflammation in the airways. If you're taking the inhaler correctly, then you will have much less in the way of asthma symptoms. So your asthma becomes better controlled. Even though you're on a medication, of course, you don't want to be on inhalers, and that's a psychological fact. You don't really want to take these sort of inhalers all your life. But asthma is one of these conditions that doesn't really go away without treatment, unfortunately. It's unfortunate that's the case. In some cases, it can improve. You can have periods when your asthma will be worse, when it will be better, but generally you may need some form of treatment throughout life. So this is something to just be aware of. There are situations, like I said, where asthma will improve on its own, but in most cases you need a bit of treatment. Now, if you're going to go for a treatment, I would first suggest discussing with your doctor about going on effective inhalers on the right doses at the beginning. You may have to be on maybe higher doses for a few months, and then if you're feeling really well, all your symptoms are gone, your asthma is well controlled, there is a provision to step down treatment. So you can reduce the doses, maybe you half the doses. And you see how you go for a few months. If things are good, then maybe you drop it down further, while at the same time working on other ways to help your health. So having a better diet, more exercise, avoiding allergens and asthma triggers, things like that. So there's a lot of things that go into asthma treatment. And I did go over this in several other videos on this channel if you want to check them out. If you look under this video, click my name, go to the channel, go to the search box and then just type asthma. You'll probably find quite a lot of videos that I've already published. But this was just a quick comment to let you know that inhalers are inherently quite safe medications. Of course, there can be some side effects. You can read the leaflet if you want, but it doesn't mean that you'll get all these side effects. And if you are on an effective medication that helps your condition, I think that's not an addiction, that's not a dependence. You can implement lifestyle changes and all these other things to help your condition while you're being treated, but it may be hard to actually improve your life without getting the treatment to sort of get you past the hump, if that makes sense. So you first of all start with an effective treatment, while at the same time working on yourself, working on other issues to try to get to a condition where your health is actually better overall, and then we can reduce the treatment. It doesn't need to be the same throughout your life. You may actually swap to different inhalers. You may swap to different treatments. Other treatments may appear in the future for your asthma. It depends on your own situation. So please discuss with your healthcare providers, see what's the best solution for you, but try to keep an open mind and tell your doctor if you're not taking the right dose of medication, because it makes our job much harder, because we will feel that the dose that we've prescribed is not enough, and we will want to give you extra treatments because we think that you're taking the doses as prescribed, and we're wondering why isn't there an effect in your case. So hopefully that gives you some perspective on how I would think about this, but it's really important to just have a conversation, have a dialogue with your doctor, ask the questions. See what their reasoning is. See what your reasoning is. Try to come up with a compromise that helps your case, because at the end of the day, you're the one who's having the illness. It's not your doctor. The doctor just tries to give you recommendations, and it's up to you whether you want to follow them or not. Hope this was helpful. If you have further questions, comments, suggestions, leave them in the comment section below. I'll see you in future videos. All the best. Good health.